Thanks again for joining us this morning in our continued COVID-19 webinar series. This is our update from March 9th, and again, we're going to be covering the latest MDHHS order addressing residential care facilities, living facilities, with the focus here is going to be on the visitation, testing, and other requirements. This is Tim Gutwald talking with you all, and I'll start off the presentation. And then my colleague, she is a new partner here over at Miller Johnson, Hillary Scholten, will be addressing some of the visitation and testing requirements. As I talked about, here's our agenda for the morning. I'm going to go over some of the important definitions. You should all be, fairly familiar with these at this point, although there is some additional detail I thought in this latest order that's helpful. Then we'll move on to resident and employee protections, visitation at residential care facilities, which is kind of the area I think where the most changes, we saw the most changes, testing in residential care facilities after that, and then any other updates for long-term care providers. All right, so as always with these orders, the first question we get from clients and the first question I ask myself is, all right, to whom does this apply? Although if I'm being honest, I say, who does this apply to? I'm not quite that grammatically correct in my internal monologue. So this applies to residential care facilities, nursing homes, skilled nursing facilities, homes for the aged, adult foster care facilities, hospice facilities, substance use disorder residential facilities, and assisted living facilities. And this is a pretty consistent group that we've seen addressed and regulated by these, first the executive orders and now by the MDHHS orders. There have been some questions exactly, who it includes at various points. This order is helpful in that it does provide that nice definition, and makes it a little bit easier for us to tell clients whether it does or does not apply to them. One commonality here, as you can kind of see, is that, if you were a licensed or otherwise kind of regulated entity here within Michigan, obviously skilled nursing facilities and adult foster care, substance abuse, those all have pretty strict licensing requirements. Those are going to be the type of entities that are going to be covered by this order. Although again, homes for the aged and assisted living facilities aren't licensed per se, and they do fall under this order. One thing again that was also helpful was that it explicitly excludes independent living facilities from the definition, although maybe would have been a little bit nice if they had provided a definition for exactly what that means. Again, assisted living facility, I do think it's important to know, it's defined quite broadly. It's an unlicensed establishment that offers community-based residential care for at least 3 adults who are either over the age of 65 or need assistance with activities of daily living available 24 hours a day. Again, obviously 3 adults is, so, if someone's home taking care of their parents is not going to fall within this definition, but anything kind of larger than that is likely to meet this definition. It needs assistance with activities of daily living available 24 hours a day. I know early on I received some questions from clients who run, I guess, what would qualify as independent living facilities. And I was happy to see this definition for assisted living because I had said, I don't think you guys fall within that because you're not offering care, for 24 hours a day. You guys have some medical services available, or you help arrange medical appointments, but that sort of activity is not going to make you fall within the assisted living facility if you don't meet it from this over the ages of 65. Another definition that'll be people are somewhat familiar with that's important for this MDHHS order is outbreak testing. So that's testing of residents and staff. It begins after any new case arises, and it's required to continue until 14 days after the last positive test. Communal dining activities, that is explicitly now permitted within these residential care facilities. In the December 8th order, and I guess I probably should have said that at the beginning, is that this order replaced the prior December 8th order, which was rescinded. But in that order, they simply referred to the CMS guidance, which was quite vague and frankly didn't provide a lot of guidance exactly as to when you could continue those activities, and mostly just said, you can when it's safe. But here, nursing homes, skilled nursing facilities, and other residential care facilities are explicitly permitted to resume communal dining and group activities. Obviously, they need to continue to practice social distancing, provide hand sanitizer, require the use of masks if not eating or drinking. Again, as I mentioned, the prior order deferred to that CMS guidance from September 17th of 2020, and that one said, communal dining activities may occur. This order borrows a lot of the requirements from that CMS guidance. Again, that order requires social distancing and masking. Just kind of by way of, helpful examples, the guidance said, nursing homes and residential facilities can do things like offer book clubs, crafts, movies, exercise and bingo, again, provided people are wearing masks, people are socially distanced, that sort of thing. The order again goes over notification obligations. These are not new for everybody or, most people here on the call, but I think it's worth going over again just to make sure everybody's on the same page and to confirm for you all, what the current requirements are. They must continue, residential care facilities must continue to notify employees and residents of positive tests within 12 hours. Within 24 hours of confirmed positive tests, you must also inform legal guardians or healthcare proxies, make them aware of the positive test in the facility, post a notice near the entrance and keep it there for 14 days after the most recent positive test. And as we've been doing since the beginning of the pandemic, whenever there's a positive test, within 24 hours, you need to contact the local health department and cooperate with contact tracing. The other thing that you're required to notify on the sort of HR front is to notify employees of any CDC changes in their guidelines or guidance. For example, yesterday the CDC came out and said people who have been vaccinated can hang out, can spend time together indoors without masks after they've been vaccinated for 2 weeks. I'm not sure that, I don't know if, that would really trigger the notification here, but it certainly doesn't hurt to make employees aware of that. And it's also interesting in light of, the mask requirements and things like that we see with respect to some of these dining and activity, because hopefully most of the residents in your facilities have been able to be vaccinated at this point. Again, also another thing that's been going on for a long time that everybody's familiar with at this point is reporting of PPE data to the state to make so that they're aware of any shortages, report presumed positive cases to MDHHS and the health department. And they also, this is from the December 8th order that was rescinded, it carried over into this order. Independent living facilities are requested to report confirmed cases to the health department and cooperate with contact tracing efforts as well.
Thanks, Tim. That was really helpful. So one of the biggest changes in this order that Tim mentioned is, the loosening restrictions around visitation. And however, with that comes some increased restrictions in this order about how to carry out those visitations. This is a big change for a lot of facilities, and it is complicated because the order requires facilities to allow and facilitate visitors for their residents, but also lays out very, very detailed and explicit instructions on how to carry out those visitations. Now, in our slide presentation today, we're going to be hitting at some of the most important, the high level rules around visitation, but I do just want to draw your attention to the order itself. There are a lot of questions. There's a great FAQ on the website, and of course, I and Tim, we make ourselves available too if if you experience any questions about how to carry out these visits that's not covered here or in any of the guidance. So I think one of the most important things to note here is the mandate here. It's not permissive. It doesn't say facilities may. Facilities must allow visitors to their residents under certain circumstances. First, there has to be no active cases of COVID-19 originating in the facility within the last 14 days. And now here's a great example of what I'm talking about, how the order itself really gets down into the weeds about what does it mean originating in the facility. So, if you've got a new resident coming in with an active case of COVID, that doesn't mean originating in the facility. We'd be here all day if I went through, every last little minutia, but do know that there is further guidance there in the order itself. But however, it does apply to both residents and the staff. So if you've got cases originating either in the staff or the residents, that is part of that no active cases. And also, if it's not otherwise prohibited by the local health department or DHHS. And so, if that's just common sense, right? If the local health department, DHHS is prohibiting it, you can't have visitation at that particular point. Also, appointments and testing are required. And finally, residents who are in isolation or experiencing COVID-19 symptoms, those residents themselves may not receive visitors. The guidelines that we're going to go through today generally apply to both indoor and outdoor visits. As the weather gets nicer, outdoor visits are going to become more frequent. And again, while generally these rules apply to both indoor and outdoor, there are some exceptions, less strict requirements for outdoor visits. For example, the requirement to test does not apply to outdoor visits. And there's two slides at the end we're going to go through that really hammers out, okay, which of this applies to outdoor and which applies to indoor. So when visitation is allowed under the circumstances, or the facility is required to carry it out if those circumstances are not present, no active cases, and not otherwise prohibited, visitors must present a negative COVID-19 test within 72 hours, taken within 72 hours of the visit, pass a health screening check. We're going to get into the details of both of those on the subsequent slides. Prior to entering, must wash hands, wear a mask, and other PPE as required by the facility. There may be circumstances under which individuals are required to wear a gown, a mask, other protective equipment. If a facility requires additional PPE, the facility itself must provide that. Visitors generally have to provide their own mask. If you are in a position to provide that, all the better. But visitors can't be denied for not having the additional PPE that is required to enter. Okay. And the other big one is, visitors have got to practice social distancing. That's 6 feet of separation. This definitely applies to both indoor and outdoor. And there are a lot of additional details in the order itself about how to navigate situations like a shared room. So generally speaking, individuals in a shared room must be accommodated, and the visit itself can't take place in the shared room. So, shared room situation, both those individuals cannot be receiving visitors at the same time. The order talks a lot about health and support workers, including clergy and volunteers who happen to come into the facility for a number of different reasons. Now, they're accepted from that social distancing requirement, provided that they, are not within that 6 feet space for greater than, a 15-minute time period, and are always wearing a mask as well. Next slide, please. So one of the other things that we are looking at here is, oh, you know what? I am sorry, I forgot to tell you to advance the slide before. I apologize if that was confusing. Thanks, Tim, for handling the slides. We're on the health screening check now. Understanding the legal nuances is my forte, folks, not the tech here. So the health screening check is this is what's required. I mentioned on that previous slide there. is that we have you are required to conduct a health screening check. The order talks about restricting access to an entry point for health screening purposes. So if you're a facility with a lot of different entry points, you've got to make it clear that, folks have to be directed to this one entry point. If you can conduct health screenings at multiple entry points. But there's a requirement to put up signage saying don't enter this facility if you're experiencing symptoms of COVID-19, and if you are you have to proceed to such and such an entry to receive your health screening. Visitors must log their arrival and departure by providing the time of their visit, their contact information, and a written attestation that they will notify the facility if they develop COVID-19 symptoms within 14 days of their visit. So you can see how this order is really getting at, symptoms prior to the visit and afterwards. So there's a pretty extensive contact tracing requirement in this visit, in these in the guidelines around these visitations itself. Next slide, please. Health screenings must include a negative COVID-19 test. Again, details for that are going to be on the next slide. A test for a fever, right? So you can do the forehead or the wrist digital check. Screening to rule out that the visitor is not experiencing any other symptoms consistent with COVID-19. Now, this order itself does not define which symptoms must be included in this checklist. However, the Michigan Department of Health, the CDC have all, really gathered around the most consistent symptoms, right? Cough, sore throat, headache, vomiting, diarrhea, extreme fatigue. If anyone is in need of those definitions, feel free to reach out. But they're pretty clearly defined in other areas. A screening to rule out that the visitor has not had a known exposure to someone with COVID-19. Again, here is a little bit more confusing because the order itself does not define what exposure means, though typically it means, being within 6 feet of someone for more than 15 minutes, unmasked, who has COVID-19. And finally, this may seem obvious, but the order does mandate explicitly in several points that no visitor shall be permitted to enter if they are experiencing a fever, symptom, or known COVID-19 exposure. And that has to be made very clear. Okay, next slide. So this is a new requirement, and I think one that has a lot of people on edge, rightly so. So testing. Facilities are required to conduct point of entry testing for visitors, and this is the operative phrase, whenever possible. Obviously, this puts an incredible onus on the facility to conduct these tests, to make sure folks are positive. This is a huge burden for visitors when they're coming in. However, when and if point of entry testing is not available, facilities must require visitors to be tested on their own within 72 hours of coming to the facility and require proof of a negative test upon entry. The order requires that testing requirements for certain support staff and volunteers visiting the facility must be the same as for similar staff working in the facility. So, a lot of these facilities, you've got clergy coming in, you've got volunteers coming in, you have end-of-life palliative care workers coming in, different contracts. Those testing requirements have to be the same as for similarly situated staff working in the facility. We can move on to the next slide. There are some exceptions for testing. Testing is not required under the following circumstances. And I already mentioned, as a whole, testing is not required for outdoor visits. Visitors meeting the exceptions to the visiting standard, which is laid out in pretty explicit detail in the order, but is generally summed up as parents and certain care providers, right? So the residential facility also includes, some juvenile detention facilities, visiting a child or individual in their care under the age of 21, clergy and those other support workers that I mentioned, certain volunteers, and visitors engaging in a window visit, right, through some type of physical barrier. Though note here that testing is strongly encouraged in these circumstances. Visits at the end of life, though again, testing is strongly encouraged. And visitors 13 years of age and younger. The MDHHS has put out some pretty helpful infographics that I think help kind of distill some of this into easier to absorb tidbits. So Tim, let's go on to those next slides and look here. This order, this breaks down basically for indoor and outdoor and compassionate care visits when testing is required. So essentially the rule of thumb for outdoor visits, they don't require testing, but that rule that, you have to have no active cases does apply to outdoor visits. That applies for really any type of visit. So indoor visits, again, do require testing and allowed if no recent cases in the facility, compassionate care does require testing. However, and this is important, end of life visits are exempt from testing. And, they note here too, different rules apply for special categories of visitors, such as medical providers and those providing assistance with the activities of daily living. And there is a special guideline for residential care special cases guidance. There's just a helpful summary about all the visitation precautions that must happen. And again, here, this really breaks down those special categories of visitors and whether it's allowed during an outbreak, and if social distancing is required, and if testing is required for the visit. So just kind of taking, the broad approach here, you can see that almost never are visits allowed visits are allowed during facility outbreaks in circumstances where you're not having that close contact, or you're visiting someone in this special category. A window visit, when the barrier is maintained between the resident and the visitor. Obviously, there's no method of transmission that can happen there. There is an exception when a foster parent, guardian of a resident who's 21 years of age and under, testing is required, social distancing is required, but those individuals still can visit the facility during outbreaks. Getting all the way down to the bottom there, we do have special categories for non-medical service providers, such as hairdressers, salon technicians, cosmetologists, and providers of other religious and spiritual services. Those individuals not allowed during facility outbreaks. Testing is required for those individuals. And obviously for individuals who are providing those close-up contacts, social distancing won't be required while they're providing those services. So that is, the big takeaway, with some helpful infographics to guide you through some circumstance-specific cases. Tim and I know, are both happy to take questions now at this time. Our contact information is there on that last slide. If you want to pop that last slide up too, with our contact information, feel free to reach out by email or a phone call. We're happy to answer, any specific questions that you might have now or as they arise.
Yeah, I don't see any questions, but one thing I did want to mention was a couple things. One is that Hillary and I are happy to be sort of the bad guy. I wouldn't be shocked if, this has happened a couple times during the pandemic, where people hear rumors, nursing homes are now allowing visitors, or, something to that effect. And they think that everything's okay, and they're not aware of all the nuances and caveats to that general idea. So, you know, if people are upset, you know, we're happy for you to blame the lawyers and say, our lawyers say we can't let you in, or we have to do these things before you can come in. We're certainly happy to play the bad guys so that we understand that you guys have the relationship with these people. The other thing I wanted to remind everybody was that, and I had a question about this recently, was that there's still sort of a relaxed, when it comes to certified nursing aides, Hillary and I have talked about this too. There's a recent story talking about all the turnover at skilled nursing facilities, nursing homes, and other residential living facilities. And so we understand that can be difficult to have enough staff. And still here in Michigan, with respect to certified nursing aides, you can hire an individual that has not completed state-approved training program. If the nursing home ensures that the individual is able to demonstrate competency in the necessary skills and techniques, you can also continue to employ an individual that has completed the training but is not past the examination. And also at the moment, I went over to the licensing site yesterday for nursing aid to make sure that this was still true, and it mentioned that they're having difficulty with testing right now, and in processing nursing aid renewal applications. So, you know, they're providing some leeway or some, people can continue to work if the renewal has not been approved because of these sort of technical issues. So again, it's just something for people to keep in mind, particularly on the staffing side of things.
Yeah, that's a really great point.
Well, I don't see any questions. So again, my name is Tim Gutwald. There's my contact information. I want to thank Hillary Scholten for joining us today, and really carrying the burden on the difficult nuances of all the testing and visitation requirements. If you have any questions, her contact information is there as well. And thanks again for everybody joining us.
Thanks, everyone.